Research being done in San Diego is changing the way we view the coronavirus, which primarily has been thought of as a respiratory disease. And we're joined by Dr. Uri Manor, an assistant research professor with the Salk Institute in La Jolla. Dr. Manor, welcome.
Thank you very much.
So what is it that you have discovered?
So what our paper shows is that the spike protein, the now infamous spike protein that decorates the coronavirus, can independently damage vascular endothelial cells.
Does that change the virus from how we're now treating it or know it today, or is it just to add another element to what we know about it?
I think it adds an element. I guess I should have also added that we've really done some work on clarifying the mechanism by which this happens, the cellular and even subcellular mechanism. And what we show is that the spike protein binds to this receptor on vascular endothelial cells. Those are the cells that make up the blood vessel lining. And what happens is when it binds to those receptors, it destabilizes them, causes a change in cellular signaling that ultimately damages the mitochondria, which are these subcellular organelles that are incredibly important for ever-growing list of important processes such as metabolism, longevity. It's involved in neurodegeneration, cancer, and metabolic disorders. So mitochondria are incredibly important, and what this paper shows is that the spike protein, by binding to the ACE2 receptor on those cells, damages their mitochondria.
What does that mean then for patients in terms of symptoms and things that you may suffer from the coronavirus?
Well, I think it sheds light on what we're already seeing in the clinic. It doesn't actually show us any new things to look for in the clinic. It just explains why you get this broad range of clinical outcomes, including strokes and other vascular-related disorders. So what our paper talks about is that even independent of infection, just the very act of this protein binding to that receptor causes a signaling cascade that damages the cell and the mitochondria.
Will this change the way that we want to approach the virus in terms of right now we're using vaccines to try to, immunize ourselves against getting it, but is there something else we should be doing in terms of what you're talking about and what the spike proteins are doing to the blood vessels?
That's a good question. I mean, first of all, for the record, I'm not a medical doctor. I'm not a vaccine expert. I'm not an immunologist. I'm not even a virologist. So with that said, one thing that we believe our paper happily shows is that having immunity, having antibodies against the spike protein, not only protects us against infection by the virus, but can also protect us against this damage that we're seeing in our paper. Because if the antibodies can bind to that spike protein, then that spike protein will no longer be able to bind to our cells and those receptors and induce that mitochondrial damage. So having antibodies against the spike protein is a really good thing. And the vaccines give us that. So it's actually quite wonderful. In terms of other ideas about therapies or approaching the disease itself, that's a future direction for us to try to understand what drugs or other therapeutic approaches might help mitigate the damage to mitochondria in the case of coronavirus infection or spike protein binding to those vascular endothelial cells.
So one big takeaway is another reason to get vaccinated. And Dr. Uri Manor with the Salk Institute in La Jolla, thank you so much for your time today.
Thank you for having me. Appreciate it.